Hello and welcome to my channel. This lecture we will continue our talk about the upper limb, so let's begin. It's about the vessels and nerves in the arm. Of course, the major vessel in the arm is the brachial artery. It's a continuation of the axillary artery at the lower border of teres major. Remember how the axillary artery is formed and how it terminates just by changing names at the level of the lower border of teres major into brachial artery. It's medial to the humerus and proximally and anterior distally. See that? It's medial proximally and anterior distally, covered by skin, fascia, and crossed by the occipital aponeurosis, as you can see here in the cubital fossa. It passes anterior to the long head of triceps, separated by the radial nerve and profunda brachii artery, becomes anterior to medial head of triceps, coracobrachialis and brachialis muscles as it descends, and the median nerve, as you can see here, it was formed on the lateral side of the brachial artery, then became anterior in the mid-arm, and in the lower arm it's medial, became medial to the brachial artery. Take care of this info because you will be asked about the relations of the median nerve to the brachial artery in different parts of the arm: upper arm, mid-arm, and lower arm. Medially to the brachial artery is the medial cutaneous nerve of the forearm and ulnar nerves. Remember, instead of the medial cutaneous nerve of forearm and ulnar nerves, there was the medial cord, but in relation to the axillary artery, proximally. It ends in the cubital fossa by dividing into radial and ulnar arteries. In relation to the pronator teres, as you will see, the ulnar artery is deep to pronator teres, and the radial artery is superficial to it. And it's accompanied by venae comitantes. The branches of the brachial artery, the major branches, the arteria profunda brachii, or the deep artery of the arm, or profundus profunda brachii artery, arises from the lateral surface of the brachial artery. Yes, you will be asked about this too. Arises from the lateral surface of the brachial artery near the teres major, and runs with the radial nerve in the radial groove behind the humerus. So if you're asked a question about fracture in mid-humerus, which nerve will be affected? The radial nerve. Where does the bleeding come from? The hematoma comes from the profunda brachii artery because it's torn in the groove in the middle of the humerus. It gives muscular branches, nutrient artery that enters the nutrient canal in the humerus near the attachment of coracobrachialis. It's a big artery. Anterior descending, see the anterior descending artery branch with the radial nerve pierces the lateral septum because the artery was posterior in position first, then became anterior, and the posterior descending branch. So it gives anterior descending and posterior descending branches that will share in the anastomosis around the elbow joint. Okay? Other branches of the brachial artery are the superior ulnar collateral artery. See, this is the superior ulnar collateral. It descends and pierces the medial intermuscular septum together with the ulnar nerve because it accompanies the ulnar nerve. The inferior ulnar collateral artery, anterior to brachialis muscle, it gives a posterior branch, as you can see here, to communicate with the descending branches of the profunda brachii artery in the anastomosis around the elbow joint. And you can control the bleeding by compressing the brachial artery laterally, proximally, because you are compressing it against the humerus, and posteriorly or backwards distally. So remember, to control a bleeding in the arm, if you're compressing the artery proximally, compress it laterally, not posterior. But distal arm, compress it posteriorly, because now you are on, you will be compressing it against the lower end of the humerus. And ends, as mentioned before, by giving the radial and ulnar arteries. Now, the basilic vein and cephalic veins. These veins come from the dorsal venous arch of the hand. The cephalic vein is lateral vein, and the basilic vein is a medial vein. The basilic is superficial and between the biceps and pronator teres muscles. It mingles here with branches of the medial cutaneous nerve of the forearm and pierces the deep fascia at the mid-arm and runs medial to the brachial artery. Remember, because it will become the axillary vein later at the level of the lower border of the teres major. The cephalic vein, on the other hand, is superficial and between the brachioradialis and biceps muscles on the lateral side, ascends lateral to the biceps in the deltopectoral groove. It appears in the deltopectoral groove in muscular persons. You will see a vein in this region. This is the cephalic vein. Drains into the axillary vein and connected with the basilic vein by cubital veins. See, these are the medial and lateral cubital veins, or the median cubital veins. These are the veins that we use as site for injections. See the connection between the cephalic and the basilic, the median cubital veins. The lymphatics of the upper limb on them go to the medial side, group of lymph nodes called the supratrochlear lymph nodes on the medial side, and then from it to the axillary lymph nodes. The nerves of the arm, we have the medial cutaneous nerve of the arm, crosses in front or behind the axillary vein. Remember, the medial cutaneous nerve of the arm was the most medial structure in the arm. Becomes medial to vein, as we studied before. Medial to brachial artery and basilic veins, and basilic vein, pierces fascia and supplies the lower part of the medial part of the arm. This is the medial cutaneous nerve of arm. On the other hand, the medial cutaneous nerve of the forearm, between axillary vessels, not medial, between them, medial to brachial artery and basilic veins. Now, after it ended its story with or relation with the axillary vein, pierces fascia and divides into anterior and posterior branches to cover the medial side of the arm and supplies the medial skin down to the wrist. Down to the wrist region, the medial cutaneous nerve of the forearm. Now that you have supplied the medial side of the arm, the medial side of the forearm, remember the upper lateral cutaneous nerve of the arm for the lateral side, lower lateral cutaneous nerve of the arm from the radial, the upper lateral was from the axillary, and the lateral cutaneous nerve of the forearm, which is a continuation of the musculocutaneous nerve. The median nerve has two roots, as we studied before, related to the second part of the axillary artery, formed on the third part, okay? So you can say related to the second part or the third part because it's formed on the third part. Well, we will not stick to this detail. Uniting anterior and lateral to the artery. It's lateral to the brachial artery at first. It's not, see, lateral to the brachial artery here, and then crosses the artery from lateral to medial and becomes medial to artery in the lower arm. Okay, and medial to artery in the cubital fossa, on the brachialis muscle, separating it from the elbow joint. So in supracondylar fractures, the median nerve is affected. In supracondylar fractures, or fracture of the middle portion of the lower end of the humerus, the median nerve will be affected. We'll give a condition called the ape hand. We will study it in the hand. The ulnar nerve between the axillary artery and vein, medial to the brachial artery in mid-arm, pierces intermuscular septum and grooves the back of the medial epicondyle. See, grooves the back of the medial epicondyle. It's liable to injury here if there is a fracture of the medial epicondyle. Okay, and all of us at least once experienced this, shooting electric current in the medial side of the forearm and down to the little finger if we strike the medial epicondyle against the hard surface, and pierces the flexor carpi ulnaris when entering the forearm. Now for the three main nerves, the radial and median and ulnar nerves, when they enter the forearm, each pierce a muscle. The radial nerve, the brachioradialis, related to brachioradialis. The median nerve is related to the pronator teres, and the ulnar nerve is related to the flexor carpi ulnaris muscle. Now the radial nerve, the one you see here, this is the radial nerve, posterior to the third part of the axillary artery and brachial artery, with the profunda brachii artery in the groove, pass between the long head and medial heads of the triceps, then lateral and medial heads of the triceps, and supplying, this is the pattern of supply, remember, LM, long medial, then lateral medial. In the radial groove, it's covered by the lateral head and pierces the lateral septum, intermuscular septum, and becomes between the brachioradialis and brachialis muscles. Anterior to the lateral epicondyle, it divides into superficial and deep branches. Superficial and deep branches of the radial nerve, and because it's related to the lateral epicondyle, it's liable to injury in fractures of the lateral epicondyle of the humerus. A lot of clinical stuff in the upper limb more than the lower limb, if you have noticed. Branches, muscular branches to the long and medial heads of the triceps before the groove. In the groove to the lateral and medial heads and anconeus in the groove. It also in the groove gives the posterior cutaneous nerve of arm and the lower lateral cutaneous nerve of the arm. It supplies after the groove the brachialis, lateral part, the brachioradialis, and extensor carpi radialis longus after piercing the lateral septum, intermuscular septum. It gives articular to the elbow joint according to Hilton's law. Remember that. I remind you with it that any joint, for any joint, the muscles acting on the joint is supplied by the nerves, same nerves supplying these muscles. The superficial branch of radial continues as lateral cutaneous nerve of the forearm to the dorsum of the hand, and you can feel the branches of the superficial branch of radial palpating it in the anatomical snuff box at the base of your thumb, the tendons going to your thumb. If you rolled the skin over these tendons, you will find the branches of the superficial branch of the radial nerve. And the deep branch passes through the supinator muscle and supplied together with extensor carpi radialis brevis. Now, unfortunately, in exams, they stick to details about the pattern of supply of muscles. I mean, for the supply of supinator, you can't say only the radial nerve. No, the deep branch of radial nerve. Extensor carpi radialis brevis, the deep branch of radial nerve. Okay, got it? Tendon jerks. The biceps tendon jerk is located Its center in the C5 segment of the spinal cord. The triceps jerk at C6. The brachioradialis at C7. Okay, and to remind you of the fractures of the humerus at the surgical neck, what nerve will be affected? The axillary nerve, exactly. Where do the bleeding come from? The circumflex humeral vessels, because related to the surgical neck. In the shaft, what's the nerve injured? The radial nerve, because it's in the groove together, and the bleeding come from the profunda brachii artery. The supracondylar fracture affects the median nerve, because the median nerve is anterior now to the lower end of the humerus. And the medial epicondyle is for the ulnar nerve injury, and the lateral condyle for the radial nerve injury. This concludes our talk about the vessels and nerves of the arm. I hope you got the maximum benefit of this lecture, and thank you very much for watching.